So the next person is Neha. So she want to know stages of cancer. So can the question is, can stage 4 breast cancer be cured? And she also want to know what are the risk factors what are the factors that contribute in developing a breast cancer?
Okay, so two questions. Let's start with risk factors. The most important thing is genetics. Like if there's a family member, family history of like a gene like BRCA1, BRCA2, CHEK2, TP53 mutations. These are the different cancer causing genes which can actually be in the families. And this is a long list. If anyone in the family member have one of those genes, or if you have multiple family members with breast cancer, or family members with multiple breast cancers, or family member with ovarian cancer, family members with men with prostate cancer, that could be a sign that, hey, there may be a gene in the family. So you may want to go and do genetic testing or talk to the doctor about, hey, do I need genetic testing? So that will be one thing. Now, I'm going to say that that's probably less than 20% or less than 15, 20, 10% of the population who may have a gene in the family. But majority of the cancers are random, sporadic. We get asked this question, why do I get cancer? I'll say like it's random. We don't know exactly. There may be it's a freak incident. Now we know that for sure. If you have even without genes, if you have multiple family members with breast cancer, there's more likelihood of getting breast cancer. There's a model, you can go on the internet and search Gale model. You can get a Gale score if you put all the features, and it will tell you like what is your lifetime risk of breast cancer. So we use the tool sometimes here. Different models like Tyler Cuzick model, which can give you a score of what is the risk. I also say that obesity, taking a combination estrogen progesterone, particularly after menopause, has been associated or linked to getting breast cancer. So these are the things I'll say is important. Alcohol, smoking in general can cause increased risk of breast cancer and other cancers. Healthy lifestyle is important. Weight reduction, exercise helps prevent cancer. I'm not going to give you an exact number, but I will say that goes with a lot of things about having a healthy immune system actually helps prevent cancer. Our immune system is basically like the first line of defense against cancer. So I would recommend everyone to have a healthy lifestyle, healthy diet, exercise.
Doctor, the way that you have put that lifestyle, so is it considered like a lifestyle problem?
It is
diabetes.
Yes, I mean there is a link. For example, diabetes, obesity, overweight. The hormone balance, the hormone interaction may be a little different. Those patients may have higher level of estrogens or different hormone equations, which could increase the risk of cancer. But more than that, we also know there's more inflammation. Our cardiologist will tell you things like metabolic syndrome, high inflammatory states in people who don't have a healthy lifestyle or overweight or diabetes and different risk factors. Chronic inflammation causes cancer, stimulates cancer. We have seen that in different examples, like for example, even in throat cancers, gastric cancer. Some of these are inflammation driven. Therefore, having a healthy lifestyle, keeping your inflammation down, getting a stronger immune system protects against cancer in general.
And reduces the risk.
Yes.
But still, so far, we have not found exact reasons why it happens. That's what
there are reasons, and that reason is can be very, very diverse and different based on the various type of cancers we had discussed. Gene mutation, that the genes that come from your grandparents, parents, and
Mm.
the genes which we pass on to our children, those are
Mm.
fixed. Like I
Yes,
was saying,
yes.
BRCA1, BRCA2, like Lynch syndrome genes, P53, CHEK2, PALB2, ATM. Look at that list. Actually, I
Mm.
have a gene panel in my clinic which tests for
Mm.
91 genes.
Oh.
Yeah, all these genes have been known to be associated with different cancers. But I'll tell you what, less than um, less than 10% of the time or 5% of the time, these gene panels come back positive. Still tells you like most of the cancers are random.
Mhm. See, okay.